imaging the hip and why it matters, and begin to think as we image what the implications are on the biomechanics of the hip and the hip reconstruction. And I'm showing you an arthroscopic image because I wanted you to see with your naked eye here what exactly we are trying to see when we image the hip, either with the radiograph or the MRI, and what the limitations in seeing and understanding the intra-articular pathology might be. So there are some important applications of imaging in 2010 that are new, and you heard a talk earlier about how MR might be used to image wear particles and wear osteolysis, and certainly that's something we used plain radiography for. But also, imaging of the hip is important for determining the morphology of the hip, the mechanics of the hip, defining chondral injury, and defining impingement, which is a new, timely, and important topic. So let's talk first about using imaging to define hip morphology. And what that means when I say morphology is the relationship of the femur to the pelvis, the leg length, the offset, and the coverage of the hip. And so we'll run through what you can determine from a plain radiograph in some of those indices and begin to think about your hip reconstruction in the process. And there are a number of radiographic indices defined in the literature, which you will see referred to in discussions of hip templating and reconstruction of hips. And the acetabular index, the index of elevation is one of these, and you'll see a lot of these measurement angles that you would take off of a plain radiograph are measurement angles that would be used to define the amount of coverage of the femoral head within the acetabulum. So this angle here from the just above the fovea on a horizontal line to the lateral edge of the acetabulum defines the index of elevation. The extrusion index is how much of the head is covered by the acetabulum, and a ratio of the covered head to the uncovered head, all determined off of a plain AP radiograph. It happens that the teardrop is the most reliable landmark in a plain radiograph that accounts for rotation and tilt of the pelvis. So if you were trying to compare x-rays one from another, using the teardrop and measuring off of the teardrop is the most reliable angle to measure from. And authors have defined lateral subluxation and superior subluxation based upon difference from the teardrop. And while I've quoted you some numbers here, there's not empirically a right or a wrong, but it's something that you would want to compare over time. And if you're contemplating hip replacement, how does your reconstruction re-approximate the normal? The femoral neck shaft angle, pretty obvious. The peak to edge distance, another measure of hip coverage. This is interesting and new, the idea of crossover sign as it defines impingement. And we'll talk about this in a little bit more detail, but the idea is that from an AP pelvis you can trace out the anterior rim and the posterior rim, and when there's crossover of the anterior rim over the posterior rim, there's potential for anterior impingement, and that may have implications in treatment decisions. Shenton's line is the most commonly used method of assessing in DDH whether the hip is anatomically aligned and whether it's displaced from its normal position. And femoral neck offset is another important radiographic measurement that you can get from a frog leg view, and the offset may be relevant to impingement in impingement procedures, and it may be relevant to positioning of a component in a hip resurfacing procedure. All right, how about imaging of chondral or labral injury pathology? What we're looking at here is the ability to image subtle differences, subtle abnormalities in cartilage, shear injuries, the ability to detect delamination of the cartilage that you see here. These are important prognostically. In Perthes disease, in a plain radiograph, you certainly see the abnormal hip, the coxa vara, but you don't appreciate the chondral delamination, which is an important part of the decision making. What you definitely want to be able to image and diagnose is the absence of articular cartilage, because that has major implications in terms of the success rates of your hip preserving procedures. The diagnostic yield of a plain radiograph in terms of these different entities. You can see plain radiographs are very poor at determining chondral defects, isolated chondral defects, and only detect a third of the loose bodies. This is really important because the duration of pain and the time that pain has been present correlates with the degree of degeneration, and your ability to do a conservative hip procedure correlates with the amount of degeneration in the hip. And so if we look at the relationship between diagnosis and outcome in arthroscopy, for example, when degeneration is present, osteonecrosis is present, damage to cartilage, the outcome is significantly worse. In terms of imaging, if you use MRI, you're much better at diagnosing labral pathology. If you use MRI with gadolinium enhancement in the joint, you substantially improve your accuracy in diagnosing. With the MRI, you get the ability to look at the chondral surface, you get the ability to look at the bone, and you get much more detail in the soft tissues than you do with plain radiography. And you can see in this case it's gadolinium enhanced with intra-articular. Just a brief mention again on the impingement. Remember this crossover sign. It's obviously determined in part by the position of the pelvis and the degree of lumbar lordosis, but it's important because impingement can lead, and as you'll hear in the discussion of impingement, it is important to not only image and understand the underlying morphology that led to the labral tear, in addition to treating the labral pathology to achieve the best outcome for the patient. So hips with labral tears are much more likely to have a morphologic abnormality. Lastly, newer MRI imaging techniques, radial imaging, can give you a better assessment of the shape of the femoral neck, and you can see these cam lesions, these bumps on the femoral head-neck junction and in the metaphyseal area. Again, another demonstration here that would lead to impingement, labral pathology, and chondral delamination. Important to image these and understand these in order to treat the pathology appropriately. Thank you very much.